After you did the decompression and laser therapy, and the patient reported that the treatment felt pretty good, that it gave you a pleasant feeling, that your range of motion, your ability to move forward, back, left, and right was increased from what it was 45 minutes prior to that. And the pain was about the same as far as it kind of, so getting out of that little line there, that he kind of felt that it felt kind of good while you were on the table, or while the decompression machine was working. But yet at the same time, at the end of all that, you felt that pain's about the same as it was before. And that is certainly not what is ideal. The worst case scenario is when nothing changes at all and a person feels where they're on the decompression that they're missing the boat, that this doesn't seem to help one bit. If it hurts a little bit, that's better than no change at all, because it lets us know that what we're doing is having an effect. Maybe it's a little bit irritating, but it lets us know we're in the right area. And then the best scenario is, of course, obviously say, oh yeah, it feels very good, my pain's going away. It's a very simple case of open up the disc, pressure goes off the nerve, pain goes away. And sometimes I see that like that, where it's just a night and day situation. People like that usually have a fresher injury. They are the type that when they stand and walk around, the pain comes on, gets worse. When they lay down, pain goes away pretty fast. You know, it's kind of up and down.
Why do people have operations?
Well, operations used to be the only way thought of to deal with her injured disc. That was your option. It was pain. There was a pecking order. First, you hurt, you kind of deal with it. You take ibuprofen at home, Tylenol. It's a little bit worse. You say, well, I'm going to go get in a hot tub, I'm use an ice pack, I'm going to maybe go see a massage therapist, chiropractor. Maybe at that point consider physical therapy. Usually not. Usually people go to physical therapy, they go to their primary doctor, and he says, well, yeah, you probably hurt, take a prescription, something a little bit stronger, and that doesn't work. Okay, let's do some physical therapy. After that, that's not so much, then let's do some injections, you know, and that kind of moves to the next level. And there's a pecking order. There's a way to do everything. As the most invasive thing you want to do last. Even a patient like the last patient that I came through, you know, I said decompression is kind of a big element for what that person's condition was. I said this doesn't need to be done for what they have. That's overkill. And so there's some other things that can be, you know, done before that. But most of the time, by the time people get into this office, they've already done physical therapy, the chiropractic, the injections. About 30% of them have already had surgery, and they've all failed or not resulted in what they wanted. And it's kind of it's kind of a, you know, this is a big kind of thing to start off with you know, the first person back pain. So see if an adjustment helps, see if exercise helps, you know, these kind of things. So that's why surgery is still done.
Well,
some is customary.
You're looking for a miracle. You know,
well,
you're looking for something that will help you forever. But
exactly, and quite honestly, I mean, there's no way to get around it. Age and gravity are what we're fighting here with discs.
And arthritis.
And arthritis is a result of age and gravity pushing down on it. And I know an answer right now that'll make your back stop hurting, no doubt about it. You get up in space. You get in gravity-free situation, this pain goes away. It's gravity. That's the big problem. Now that's a ridiculous expectation because we're running $1 million a day to get up there. You know, just get on the space lab or whatever, International Space Station it is now. But it lets us know that the symptoms go away when you reduce gravity, and that's what we want to reverse and minimize. Can I make your discs back to the way they were when you were 18? No. Is it my goal? Absolutely. Does it ever happen? No. But can I get them significantly better than they are now? Yes, that happens daily. And the way we do that is with a combination of things. It's the decompression therapy is part of it. You felt that the laser is a huge part of it. Getting the muscle spasms that are guarding this injured joint to relax is another component of it. Keeping things lined up are another component. Getting people to have the right nutrition in their body is another component of it. Getting them to drink enough water. All these things come along there because we like to force people to drink water, swallow their vitamins, or wear something in their shoes that don't feel good in the beginning. And I have to argue, you know, not argue with them, but deal with those complaints daily. It's because we know to get long-term lasting effects, these things all add up to success. Yeah, one of the questions was, is there any other doctors doing decompression up that direction? There are a lot of other doctors doing decompression.
She has a sister-in-law that's
Well,
in
she's,
need.
well,
Oh.
she's had a lot of back problems and surgeries, and she was just diagnosed with 2 more bulging discs in her neck, and she said, no, I'm not having any more surgery, and so I think she's just taking pain pills
Yeah, yeah.
At this point.
Where's her home at?
in North Ogden.
Um,
She-
I don't have a great doctor that I know of that's working in there. There's guys in Layton that I like. They're what's called the Spinal Aid Centers of America. Now, Spinal Aid Centers of America are a group of, well, it's a corporation that's a franchise. Just like if you have a hamburger shop and you join a McDonald's, all of a sudden you become McDonald's.
Yeah.
And you have to serve McDonald's food. But you're basically making
Yeah.
hamburgers. And so these doctors have to become certified through Spinal Aid Centers of America. And I think there's about 200, 250. The programs work pretty good.
Do they have the laser?
franchise. They don't have the laser that I know of yet. I used to work with them a bit. We are Utah Spine and Disc, and this actual location is the world's largest decompression center. Right here in Murray, right? But and that's nice and that's great. But what it means is the program that we have is pretty neat. He was talking about this consulting this company that was putting together, is helping everybody understand how our protocol works and what is done to make success. Because success has to be in healthcare, has to come from referrals, which has to come from people that have had success. It doesn't come from advertising per se, you know, or location, because certainly we are the most located.